you, for example, can't afford the eggs for the house, or you can't afford the weekly grocery shop anymore. It gives you extreme defeatism.
I see a lot of patients with sort of severe depressive illnesses, and a lot of them tell me that seeing their bills going up, that does seem to have a detrimental effect on their mood. So I see people that have been stable for a long time telling me that they've noticed their mood dropping, and of course that then means that they have to have increases in their medication, which then causes a burden of side effects.
I am one of the fortunate ones who's been able to get someone to talk to, a professional health professional, but I know plenty of people who are in waiting lists for months on months, and there just isn't enough. There isn't enough workers, there isn't enough people, there isn't enough professionals to deal with the volume of people who need genuine help.
During COVID particularly, we did see a big spike in demand for mental health in general, and I think really we've been playing catch up. And of course this cost of living crisis on top of that is impacting further. I think the thing that we really struggle with is recruitment. And of course, because a lot of these jobs are not particularly well paid, we're finding that people that were on sort of standard NHS contracts are leaving the service. What we're finding now is that even when we're offering agency positions, we just can't fill those posts. So our older adult service in particular is almost unstaffed.
It kills your mental health knowing that the people in front of you may be better off than you, and so they don't have to think twice about what they're buying, while you're here adding up pennies, potentially trying to make it seem like you're okay, even though inside you're suffering, or you're screaming, or you're realizing that, well, this was the budget for my next 2 days gone down the drain.
I'm pleased to see the government have already stepped in to kind of address the problem for most people by sort of putting a cap on the prices, but I think it's always the most vulnerable people that suffer the most, isn't it? So a lot of our patients have got sort of very chronic and very severe mental health problems that renders them unable to work, and they're relying on a combination of universal credit and personal independence payments, which actually don't go that far. So I think it needs to be a broader spectrum of help, but perhaps with that little bit of extra for those that are really struggling.